Hey everyone, welcome to researchmd.com. We got another great presentation today. We're going to look at is yoga effective in migraine, right? A chronic debilitating headache, migraine headache. So does yoga have any effect? In all our studies, remember, is based on pure science. If there's no scientific study behind it, we will not publish it, or we will not even talk about it. It's very, very important. So our channel is based on pure science. I just want everybody to know that. Again, my name is Pramil, Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students. I do research. I'm a research director. And I'm also an assistant professor of medicine, 2 major medical schools. Okay, what is migraine? So migraine is a form of sensory processing disturbance. Used as like a brain-centered explanation framework that is like, painful condition, painful headache. So familiar, like there's like a lot of history, like a lot of information coming out. Maybe it just kind of transfer from family to family, and then epidemiology is very common in the females. And the migraine without aura, there's different types. We're talking about major cause of disability. We lose a lot of money because of the migraine. The amount the loss of days to work is like very, very high. Okay, triggers could be emotional stress, flickering light, visual stimuli, hormones in women, not eating, weather, sleep disturbance, you name it, everything, like even alcohol, specific food, smoking, and all of this could be like triggers. So the next thing is like we did some literature search. You find this greatest study published in the headache journal, in the Journal of Head and Facial Pain. It's a scientific study on headache. They're looking at the effectiveness of yoga therapy in the treatment of migraine without aura. So that's what they look at it. Okay, the type of migraine without aura, is a randomized control study. So objective of this study is to investigate the effectiveness of holistic approach of yoga therapy for migraine treatment compared to self-care. Okay, so when you talk about the study, like the strength of the study, it's a randomized control study. Anytime you see a randomized control study, that's like the evidence is like very, very strong. So, so they looked at primary outcome was like headache frequency, headache diary, severity of the migraine, and the pain component. Okay, so what is our results show? 3 months intervention, right? 3 months of yoga therapy with the self-care, and they're looking at the results, statistically significant result. Decrease in frequency of headache, intensity, and the duration of the attack, medication score, component of the overall intensity, anxiety, depression, statistically proven it is decreased in the yoga group. Okay, so you got the results like nice table right here. Compared with the yoga group and the self-care group, significant results, my friend. Okay, in conclusion, based this randomized control study, I'm underlining randomized control study, okay, demonstrated a significant reduction in the migraine headache in frequency in clinical and associated features in patients treated with yoga. So based on this study, we can clearly say that yoga is an effective treatment to decrease the migraine symptoms, okay? Compared, if you don't want to, let's say, take any medications for migraine, or you're afraid of taking medications, always, look into this yoga therapy and see if it's going to, give it a chance. Definitely it's going to work. Thank you so much for watching. We'll be back with another presentation soon.